Hey, for folks who are tuning in, just sharing some of the links here through social so we can get started. Thanks for joining. Just give me one moment. Just one more moment. My computer's not used to having to do all of this multitasking. All right. Thanks everyone for joining. This is our 49th Ward virtual town hall. So my name is Maria Haddon. I'm Alderwoman here in the 49th Ward. I am broadcasting live from the 49th Ward Service Office, which is closed to the public, but you'll see me in here most days if you walk by on the Greenview side, as I'm still coming in as a nice place to do some work and get a slightly better internet connection than in my apartment, and also giving Natalia a little space. So thanks, folks, for joining. I'll be doing these town halls weekly, these virtual town halls, making sure that we're still getting to connect in some way. Goals are to really just share information, keep you as updated as possible, and then also you can chat questions in the box here. If I've got answers for you now, I'll answer them now, and otherwise we'll try to share some big changes have happened today and this week. One of the big announcements was the order that our Commissioner of Public Health entered with the mayor closing our lakefront to the public. We know that we're in a very critical space as a city and as a state when it comes to our spread and the new cases of corona. This is all the social distancing, everything about staying home to stay safe. We need people to stay home unless you have to. Sir, so many people were congregating in the parks, on the playing fields, on the lakefront trail, the 606, the Riverwalk, that the health commissioner and the mayor felt that it was necessary to close these spaces, and they will be enforcing it with citations. Got a question here about, will side streets like Ashland be closed for folks to get in movement and bike safely? Other cities are creating temporarily protected bike lanes. Why are we not responding as aggressively? Courtney, I don't have an answer for that right now, but definitely we'll follow up. I know that one of the things that CDOT has done is, we'll share this in the newsletter tomorrow, they are reducing rates for divvies to encourage people to use bicycles. And with the delayed traffic because of the governor's stay-at-home order, there is a lot less traffic on the streets. You can go to .gov, I'm typing it in here, /CDOT, and CDOT will be providing resources as well for alternative routes, especially for people who really rely on their bicycle transportation for commuting. So that website's got alternative routes to folks. So the reason this lakefront closing was done is because people were not following the guidelines. We need everyone to chip in here. We need everyone to do their part. If you're not an essential worker, if you're not going out for food, if you're not going out for medicine, you are allowed to take walks, run, get your exercise in your immediate area. Please recognize and respect social distancing. We know a lot of folks in our neighborhood are definitely practicing this, but there are plenty of folks who still aren't getting the message. Maybe they're not fully understanding the gravity of the situation. But I'll share back what the mayor mentioned today on the afternoon press conference with other mayors in our region, which is on our current course, we're looking at 40,000 critical cases of people who will be impacted and infected with this virus. Those are critical cases that would need critical care. We do not have the beds in our hospitals. We do not have the equipment. It would collapse our medical system and devastate our city. So I mean, it couldn't get more serious than this. We really need people to do their part. I'll share some information about, if you don't already know, you can go to chicago.gov/coronavirus for all the latest information and guidance from our commissioner, Dr. Arwady, for public health. You can also, here in Rogers Park, I just finished a call with our wonderful community response team. So the Rogers Park Community Response Team was created about 2 weeks ago. We're coordinating an effort to connect people to resources for housing, for food, for your small business. We're working on housing issues around rental and mortgage assistance. We're doing fundraising. We're have over 500 volunteers who have signed up. We've got over 30 volunteers working our hotline where people can call and get access to this information. And we also have deliveries that we're doing. So if you need access to your groceries, but you are confined to your home, you're part of a vulnerable population and trying to limit your contact, we do have volunteers, I think over 50 of them, who are willing to pick up your meds or pick up your food to take them to you. So we're figuring out a lot of structure still, but you can access our website. It's rogersparkcommunityresponseteam.org, and the hotline number there I'll also bring up. We've got volunteers working a couple shifts a day on the hotline. You can also, if you're interested in volunteering, fill out a form there on the site to sign up and help other people directly in your neighborhood. So big appreciation to all the folks who've already signed up and are looking for ways to help. Couple other important things. We had the federal government, right? Hopefully we'll see by tomorrow if Congress passes this $2 trillion federal aid package. It's something like over 880 pages. Our finance people in the city are going over those documents to make sure that we get as much information as possible to you on how you can benefit. Some of the big details so far are that most people will be eligible to get a one-time $1,200 payout. People with children would get an additional $500 per child as some immediate financial relief. We'll see there's supposed to be a lot of funds included as well for small businesses. That's something that I know is important and impacts a lot of us. So not just our business owners, but the folks who work in our small businesses and all of us who rely on them for our much needed goods. So very excited about that package. There's also going to be expanded unemployment. So 4 months of full payment for people on unemployment. So I think that's an exciting provision as well. So the newsletter that we'll send out tomorrow, probably tomorrow afternoon, we'll have as many details that we have on that, as well as what's happening at our state and local level. We have a Chicago Resiliency Fund that's for small businesses. We have a Chicago Emergency Response Fund that is just issued their first and direct assistance to residents in communities around Chicago. And today the governor announced a similar fund that'll be working for the whole state. So I just want people to know things are scary. We're going through a lot of instability in our everyday lives, the least of which are the financial instabilities. But there are many individuals, organizations, and certainly your local government that's working to try and get dollars, to get aid, to relieve taxes, and to try to ease the burden as we go through this, what everyone calls the unprecedented situation that is this global pandemic. So I want to pause there. We've got some comments here as well from Rebecca. Let's see. Saying, it's terribly difficult for everyone, speaking of the lakefront closures, but particularly those suffering from mental health conditions to not be able to visit the beach. Wondering if areas can be opened with limited brackets, such as by age, maybe from 6 a.m. to 9 a.m., setting up different schedules for different times, saying you thought originally of it, broken up by last name, but that would be an honor system. Rebecca, I haven't heard of any such recommendations so far, but similar to Courtney, this is something that I can take and pass on. I know for elective trauma, with the erosion and the flooding and the closures of the beaches there, that I know people are really feeling the pain, and not having access to that is not just an inconvenience for some, but I recognize, Rebecca, it's an utter change in what can be some. Any allowances are going to be considered in this immediate term, though you're able to go out, you're able to go walk around. The big thing that they're looking for is making sure people are not congregating in these spaces. And so I hope with the warming weather that we're able to find other ways to kind of get our nature and to get our outside time, while also respecting the closure right now of the lakefront. It's going to be really difficult. One thing I'll say is, if there are ways, if you've got some of these other ideas, you guys can email them to my office. I'm putting the address here. If you've got examples, like Courtney had kind of examples of, other cities that are doing different things. If you've got examples of what you're seeing happen in other places that you think could work here, and you want me to share these and explore and see if they could work for our city, I am always happy to take those. So please feel free to reach out and share some of those details. Few other updates. I want to remind folks that if you go to the Rogers Park Community Response Team website, someone who found out that someone that he knows just tested positive, and reached out to ask the question of how can we help them, right? So I know someone who's tested positive. How can we help them? What are resources that the city might have to share with them? And it brought up this good question that we're going to start knowing people who are sick with COVID-19. This has already started to happen for people in our community, judging by some of the social media posts. So please know that if someone has been tested and is either waiting for results, or has received their results and is tested positive, they are being given guidance by our Department of Public Health and the CDC and the medical professionals that are treating them. So they're being given guidance. They're being given information on isolation. If they're well enough to be sent home, they are getting the information that they need there. The best way we can support our neighbors and our family members is setting up some virtual checks with them, phone calls, communication, figuring out how we can help them stay in their isolation or their quarantine. And if you've got people, family, friends in your life, maybe reach out and see what you can do to make sure you can make their quarantine or their isolation experience a little easier. That's what I'm hearing from some folks. On our page here, we've got information about economic support for individuals, about emotional support and mental health hotlines, information on food and nutrition, on health and healthcare, housing and utilities, and for small business and restaurant resources. So please visit the website, check it out, contact if you'd like to volunteer. Northside Community Resources, one of our nonprofit partners here in the community, is also hosting a GoFundMe fundraising page. So one of the things that we aim to do are to provide resources and information, but also for people who are going to be isolated, quarantined, or who are our vulnerable seniors, immunocompromised folks, our neighbors with disabilities, people who are really strongly impacted by the stay-at-home order. We're trying to handle volunteer deliveries of their goods. So maybe they can get their groceries, they've got meds, but they need someone to pick these up or drop them off. That's something that we're coordinating through the response team. We're also working on what larger food access will look like. And so if you're financially stable at this point, you can also make a donation to the Emergency COVID Response Fund for Rogers Park. That's hosted by Northside Community Resources. And we'll be using the funds for that. Joshua Hoover says, how are the lakefront closures being addressed? Will there be citations, police at every entrance point? There won't be police at every entrance point. They are to, I think the maximum is $500. The directives that police have been given when patrolling the areas, and this is for the lakefront, but this goes for any gathering that's over 10 people. So if you're having that like pickup soccer game over, there was big soccer games happening over at the field at Eugene Field. So it doesn't just have to be the lakefront. Police will give you disperse orders. So they'll use their kind of loud PA system. You will get 3 warnings. With 3 warnings, if you do not comply with a disperse order, you will be given a citation. If there's an escalation at that point, you could be arrested. Clearly, that is not the goal. The goal is to get people to practice social distancing, to stay at home, and to do their part to protect our broader community. But that's the directives that they've been given, Joshua. Allison says, is the city planning on blood drives? Red Cross is asking for help since the blood banks are now low to stay at home. Yes, the city, I don't know if the city's hosting them, but the city has been sending out information, and we also have a link to a few resources for the American Red Cross, the Association of Blood Banks, and for Vitalant on how you can make appointments. So I'll go ahead and copy the link there. This is a great point, Allison. It's something that is coming up because people are staying at home, because people are avoiding contact. Our blood banks are running low. If you are healthy, if you are able, and are willing to give, it's something that's very necessary. If we don't have enough blood, we'll have additional complications that have nothing to do with COVID-19 when it comes to medical care for everyone else. So thanks for bringing that up. Couple other pitches that I'm just going to make for folks is now more than ever, it's important that we stay connected, and we have increasing challenges in how to do so. Not everybody can follow a YouTube live town hall. Not everybody is signed up for email newsletters. Not everybody has internet access at home. And so some of the things that we've been asking is, if you're watching this, you've got internet access, please sign up for my newsletter. If you're not already on it, you can do so. Putting the link here. There we go. There's a link. You can also do so just by visiting our website, 49thward.org. Sign up for the newsletter. If you're living in a multi-unit building, or if you've got, friends or a neighbor that aren't getting this information, please print out. We've got like a shareable folder that I put out in the newsletter. Print out some of the information. We've got flyers in multiple languages, related questions. So I need your help in reaching more people and getting the information out. And we need to do this regularly because clearly there are a lot of folks in our community and around the city that still aren't quite getting the message. And we need to make sure that we're reaching as many people as possible to share this life-saving information. So I appreciate folks helping out with that. Got a message here that one place nearby that you can also donate blood is the Evanston Vitalant location. Yes. So thanks for that, Chicago Duke Dog. That link is also on our website. So thanks for that plug. I'm going to wrap it up for this evening. As always, this video will be available for folks. So if there's folks that maybe wanted to catch this, but they were working or had something else going on, you can encourage them, share the link, share the video. They can subscribe to the concerns. Myself and my team are still working on normal hours. So 9 to 5, Monday through Friday. You can call the office, 773-338-5796. You can email the office at 49thward.org to reach me with questions, concerns, whatever you need. I'll also say that there have been some updates for those of you who use 311. There are some updates to 311 where you can now, they've got codes. If you want to make a call because you use a sentencing order, that you don't, it's not an emergency, you don't need to call 911, but if you want to call 311, so that you can say, hey, there's a 50 pack of toddlers taking over this playground, and they shouldn't be doing that. You can kind of share that information, and other details. You can also call 311 if you need to get connected to Chicago Department of Public Health, if you've got questions, if you're experiencing symptoms, and if you need advice on what to do. So I thank everybody for joining. We'll keep doing these weekly. I'll keep sharing information, and I hope you guys keep in touch and stay well.